nobody knows any history on the guy. The senior person will look in his wallet, and usually we find a military ID card, or, 20 Grateful Dead tickets from 8 states. So you can tell
The tour head, yeah.
tour head kind of wasn't getting off, so he took 2 hits at the beginning of the show, he didn't get off, so he took 5 more at set break, and now the show's almost over, and he's totally out of it.
Now, another thing that's kind of good to do, because there is such a thing as bad acids, you have to remember that most of what's being sold on the street is not being made by people with degrees in chemistry from your local university. So that if they have a friend with them, and the friend is also tripping, but not very violently, you can say to them, did you do the same stuff he did? Yeah. And you can see the friend is really all right. Well, how many hits did you do? Oh, I did 2. Well, how many hits did he do? Oh, 20. That's usually your clue that there was nothing chemically wrong with the LSD. It's just that this guy had an overabundance of it. Okay, the bad LSD, and there is such a thing as bad LSD or LSD that is poorly made, the patient's symptoms will resemble that of strychnine poisoning, because indeed it is strychnine poisoning, and they need to be treated that way. It's a rather emergency situation. Bob mentioned chemical restraint. We have 3 types of restraint at Rock Medicine. We have manual restraint, physical restraint, chemical restraint. Manual restraint is usually 4 people sitting on somebody and manually restraining that person. Physical restraint is the use of leathers to restrain that person. We usually only resort to physical restraint in certain circumstances. Number 1, transportation of a patient for the patient's safety and for the safety of the crew transporting them. Number 2, if we're running out of staff, we've got more trippers that need to be sit on than we have sitters, then we may have to put somebody in leathers. Okay, but there is a right and a wrong way to put somebody in leathers. And sometimes the hardest thing when we've made the decision that we can't do this person any good and they really need to go to a hospital is to teach the ambulance crew that is picking the patient up how to restrain that patient properly. The patient needs to be restrained face down on the gurney, not sunny side up. And the restraints need to be somewhat tight. We had a situation at the Cow Palace where we had a paramedic, a female paramedic who was the goddess of paramedics and knew everything about it, and there was no way we could tell her how we were going, to restrain this patient. They insisted on restraining the patient sunny side up and at a relatively loose degree. They got about halfway out of the parking lot when the rear end of the ambulance flew open. The female paramedic flew out, the patient shortly following her, because he had, of course, gotten loose, which we had told her was going to happen.
Tore up the hole inside of the ambulance.
Yeah, really did kick the shit out of their ambulance, but we kind of felt she was.
This was a patient for 3 hours, was under our care. He had punched an EMT. He had to get 5 stitches in his forehead when they brought him in. He had abusive language for 3 hours
And we'd also
consistently.
pulled 5 knives off of him.
And then, while he was in leather restraints, managed to get 2 knives out, and one of them opened up, and he was on the floor just playing around, wanted to knife us. He wanted to have sex with every member of my family, and was upset that I wasn't upset with him talking to me like that. But after a while, you get used to it.
Is there anybody here who's never worked with Joe?
There are a few, yes.
Yeah.
Okay, I don't want you guys to think that this is what happens at all shows.
Yeah, this
That
is
really-
not every show.
It really doesn't. These
Yeah.
And this guy
these
wasn't
are-
an
these are the
LSD
horror-
problem.
these
He
are the war
was,
stories. These are the low life. These are
These
war
are the ones you
stories.
remember at shows.
Okay, now,
Really,
chemical
don't think you're gonna walk into your first show
Chemical
unless you're working
restraint.
for a night, and then these things happen.
Chemical restraint involves the administration for our purposes of medications to help us connect with the patient. We do not use chemical restraint unless we have exhausted all attempts to make contact with the patient. The patient is just hallucinating and so agitated that they can't focus enough to try and make contact with you. What we use 2 drugs, Haldol and Ativan. Haldol is extremely good for controlling the behavioral aspects. Ativan is very useful for helping to calm their own upset at the fact that they can't control their behavior themselves. Okay, we use very small doses of these medications. We use 2 and 2. 2 of Haldol, 2 of Ativan. Now, for intents and purposes, the first shot of Haldol usually gets them to a point. The first shot of Haldol Ativan, and not in the same syringe, by the way, because they're not real compatible together in the syringe. The first shot usually, after 20 minutes, works to the point where they're much calmer, and you can then try and connect with the person inside all of that behavior. If we need to go to a second shot of Haldol Ativan about 20 to 30 minutes after the first, because they haven't slowed down one bit, we will do that. If after 2 shots, 2 sets of 2 and 2, we can't get them to the point where we can communicate with them, then they need to roll to a hospital, because something may be going on. There may be an underlying psychiatric condition that has been exacerbated by the fact that they took LSD. Okay? So that it is at that point we will make the decision for the patient's safety and for our safety to send them to a hospital emergency room. Some of you, if you work in a hospital emergency room, you probably are familiar with 5150s. But in the hospital parlance, in the emergency room, they will medicate a patient with 5150. And that's usually 5 of Haldol, 1 of Ativan, and 50 milligrams of Benadryl. Because for the emergency room purposes, they want that patient quiet, they want them asleep. Those big doses are what they need to achieve that. For our purposes, we don't want that person asleep, because if we can't wake them at the end of the show, we own them till they wake up. So that is why we use 2 and 2. Okay? And that is a medical decision. It's made by the physician. If we have no physician on site, then we do not give Haldol and Ativan. And there is a point at which we will send a tripper to the hospital when we are unable to use Haldol and Ativan, or when the tripper comes in presenting with a certain picture, and that's the point where they come literally foaming at the mouth. This is somebody who is metabolically probably in trouble, because tripping takes a lot of energy. They expend a lot of energy mentally and physically when they're tripping. They can precipitate seizures, and there is such a thing as late seizures with LSD trippers. So if somebody presents really extremely intoxicated, we won't play around trying to medicate them. We'll roll them rather quickly, because we really don't want to have to deal with seizures in that setting.
Another thing is, mostly at the dead shows, is you need to use a lot of precaution as far as wearing gloves, treating the patient, and that is because there's, with the dead shows, a lot of scabies, head lice, and crabs, as I itch when I'm saying this. But the best thing to do, as you do home downs, is to use protection. Does anybody have any questions? Go for it.
What happens if a tripper hurts us really bad? Is there coverage, is there medical coverage through?
Yes, we do.
Yeah, we're going to talk about that next, so that's a good question.
Has anybody not ever worked with a tripper before?
Twice.
Everybody else has worked with a tripper. How about it with Rock Med? Who hasn't worked with it?
Well, there's a lot of
Okay, see, there may be a difference. I mean, there is a difference from where you approach, with a personal friend or on the job. But with Rock Med, the best thing to do is forget what you've learned and come in with a new perspective. Be willing to learn what we're teaching you here. Don't use what you've used on the road. Well, I don't know. Is there any more questions?
Any other questions regarding the restraint of IPRs, intense psychedelic reactions? Any questions? And all these skills too, the psych skills are really just people skills. You use the same thing when you're dealing with an adolescent ETOH, someone who's intoxicated. It's a different type of skill when you have a 17-year-old who's got an attitude who's intoxicated, but you still have to be able to do that. And like I said before, anytime you're dealing with a patient, you feel uncomfortable with your skill level or with the way it's going, don't be bashful, don't be ashamed to tag team. If you can't communicate with the patient for some reason, they don't like the way you look, the length of your hair, what you're wearing, hey, it's okay, we'll find somebody that they do like.
There's no shame at all. I mean, you can't be everything to everybody. And I've had a lot of experience working with trippers, lots and lots and lots, and so has Barbara, and had a lot of experience working with trippers, and I would call for her help all the time. If I don't think I can work with this person, I will ask somebody else.
You never know what's going to work. Sometimes it's the simplest thing you just might have overlooked it. Okay, well, thank you very much. That's great. That's good. All right, we're getting ready to wind up now. And to finish up with us, you've heard us talk about him, the legendary, near mythical, the Razman.
On behalf of Charlie and Juliana and the front office, I want to thank you for coming. I especially want to thank the training committee, the people who put this together, and the supervisors who gave the speeches. A lot of the people, one thing is, Rock Medicine is based, you are our greatest resource. Without the volunteers, Rock Medicine doesn't exist. We try to accommodate you as best we possibly can. We're always open for suggestions. We consider everything. We've been trial and error for 20 years, and we... And yes, exactly. So we're always open for new ideas from everybody. Again, the people that stick with Rock Medicine are basically very highly self-motivated and very highly self-gratified. Again, we try to do everything possible to keep you coming back to the shows. A couple of things that I wanted to go over for a lot of new people. Right now, the show seasons, there's not that many shows, as you noticed, and it's important. I don't want you to get discouraged. You have to realize in the spring, when the concerts open up, we have Cal Expo, we have Shoreline, then we have the shows in between, and we need a lot of volunteers to cover that. And then what happens in the winter, we don't have that many shows, and the lists fill up fast. So please don't get discouraged. You will get on lists, sooner or later. And again, the lists are important. VGP does give us latitude. They understand we're a volunteer organization, and we need more. We fill the list as possibly large as we possibly can, but we do have an obligation to just not let people come in and out. So it's very important that you get on the list to go to the shows. Along with the shows and stuff, we've developed a relationship with the security and the people at the different venues. And all too often, sometimes we get the security people who get overzealous in their job, and we don't want you to wind up in a one-on-one confrontational yelling match with the security people. Even if they're wrong, there's other ways to address those situations. It's much easier to walk away from it, go back to your supervisor, tell them what the situation is, and let us deal with it on that level. They have their instructions, and sometimes, again, it's a simple miscommunication or whatever, but we don't want you to get into a one-on-one situation. It's unfair to them, to you, and it's unfair to them. Again, you're representing, when you're wearing the colors of Rock Medicine, you're representing a whole organization. And over the years, I've taken a lot of what from people that I couldn't give two hoots about, and I had to basically just suck it up. And I can tell you that if they are in the wrong, they will get it from their supervisor. We will send it down there that line. The other thing is that we talked about is, yes, you're all covered with our liabilities, insurances, with the clinic, and at any time, no matter how slight the injury may seem at the time, please go use the service. If we can't take care of ourselves, what the hell are we doing in this business? Please, no matter how minor it may seem, please go have yourself examined, documented, please. Again, if you're sick, don't feel so obligated that you're coming to the show. We're not in the business of creating patients. We're here to treat patients. And when we have people that show up because they feel so obligated because they're on the list and they're sick, it's, more or less just look in the mirror and take your own advice. What would you do if you were a patient, if you came to Rock Medicine? We would say, don't go to the show, go home. So please, at the venues, we all too often don't have the communication capabilities that you can call. Please call the office. We have the capabilities to pick those messages up. Again, sometimes something happens at work, you don't get off, you can't make it to the show until later. Always remember that the later you show up to the show, the more the security gets tighter and tighter. Have patience with them. All too often these people hear all kinds of stories all the time. If you have patience, you will get into the show. Most of these people respect Rock Medicine, and eventually you'll find someone who's appreciative. If you've never been to a venue, always make sure you ask about where you get in and stuff. I basically don't think there's any more. I have to say. Again, please ask questions and see you at the shows. And I think Steve wants to wind it
All right,
up.
thanks a lot, guys. Okay. Okay, well, that's about it. That's pretty good. We cut a half hour off the last ones that we've had, so we're getting better and better. There's evaluation sheets in the packet. Please fill them out. Check yourselves off a second time as you leave, please, so I'm not sure. I'll make sure no one snuck out on us. And we also have these key rings here for everybody. So when you check out, grab one of these for yourselves, fill out the evaluation form, and thank you for being here. Thank you. And if you have any questions, now's the time to grab any of them. If you have any other questions, any concerns. And we'll see you all at the shows. Appreciate it. Good.
Who wanted to work here in the dressing room next show?
I don't like that.